A lot about blood shortages, and this time is even more serious. Blood donations are needed for some patients to survive, but it turns out many people are not eligible to give. And during the pandemic, it's an extra challenge. Galen Etlin looks at what's being done to save lives.
Dr. David Glidden at Legacy Emmanuel in Portland says the situation is dire.
This is the worst of the worst.
Blood donations are down everywhere. To his patients,
a life and death situation for some.
Most certainly.
When it feels like it's getting better, it really isn't.
Angel Montes with the Red Cross says donations have been down most of the pandemic, especially with companies and colleges operating remotely. Now with COVID Delta concerns.
Will they be able to host blood drives on site or will they not?
We're in a tough spot right now.
Vicki Finson with Bloodworks Northwest says this summer's big drop is a problem with blood's short shelf life.
How does this one compare, would you say?
One of the worst and prolonged shortages that I've seen in my entire blood banking career.
Bloodworks Northwest is taking appointments and hosting pop-up events like this one at McMiniman's Edgefield.
I might have died if I hadn't had the blood transfusion.
It's also producing promotional clips like this in Seattle with radio host Cheryl Waters, who now donates blood after surviving cancer treatment.
When I needed it, it was there.
You are on the front lines. What is that like for you and your patients right now?
Very, very challenging. We are actually still able to provide blood truly when needed, but what we're living with now is really a complete elimination of a cushion that we have been accustomed to for so long.
You're really having to budget the blood in that sense.
That is correct.
That means there's enough blood for emergencies, but providers are making tough choices to hold off on other surgeries.
There are people who really, really need it.
Dr. Kirsten Alcorn with Bloodworks Northwest helps track eligibility. The Red Cross estimates only about 40% of Americans can donate. But during the pandemic, the FDA temporarily reduced restrictions from the 80s on gay and bisexual men, allowing them to donate if they have not had sexual contact within 3 months.
Was not causing decreased safety.
Where do we go from here to make it easier for people?
We would not like to unnecessarily exclude anybody. We have to use safety as our guiding factor.
This is a community issue.
Dr. Glidden says people should reach out to see if they can donate as the need grows.
We expect this shortage to last on the order of months.
Galen Etlin, KGW News.